Hello everyone, I am Dr. Nampoothri, Senior Gynaecologist at Apollo Navi, Mumbai. We have all been talking about only one virus since the last 2 years, about coronavirus. It has come in different shapes and different forms to worry all of us. Hopefully we are at the end of it. Everybody says this is going to be the last wave. Now this wave is all about Omicron. So let's hear how COVID has affected our pregnant ladies. The first wave we know was quite kind to pregnant women. We did not have much trouble. But the Delta wave was bad. We have had lots and lots of pregnant women affected very severely with it. We have had a few deaths also. Babies also have been affected. And now we have come to the third phase, that is the Omicron. Now, as I sit here today, Omicron has also been quite kind to the pregnant women. Not many people have been really affected by it. Now, what are the signs and symptoms of Omicron? The same as in any non-pregnant woman, same as in any person. Pregnancy has not made much difference in the signs and symptoms of Omicron. People have mild fever, mild cough, sometimes mild and sometimes severe throat ache, sore throat. And that is it. In 2-3 days, people do become all right. But as you know, prevention is better than cure. We should try our best not to get affected by this virus. How do we not get affected? First of all, don't go to any crowded places. When people are together, we do tend to take off our masks. And as you know, masks, especially the N95, is the cornerstone to our prevention. Cloth mask is not of much use, however many layers you wear. So N95 is the best of it. And even when you are amongst people, please do keep your mask on, because we don't know whether the next person standing next to you is infected or not. And people start developing fever by the time they've already passed 2-3 days of having the virus, and in that phase you can easily get it from them. You don't know whether the next person is having the virus or not, so please keep your masks on. And avoid grouping of people, especially in closed places. To avoid public transport as much as you can. Wherever you are, masks on. And hand hygiene has to be there. And suppose you do turn positive, how would you know? Because of your mild fever, throat ache, mild cough, then you can almost be assured that you are having COVID in the present scenario. So many people are turning positive. Now, do you need to be admitted? Well, some people prefer to stay at home, and we also encourage people to stay at home, especially if they don't have much symptoms. Fever up to 101 degree Fahrenheit is fine with us. And if the fever does not subside in 2-3 days, if you are feeling that your symptoms are becoming worse, you are supposed to have your oxygen checked at home. If that is falling, if anything like that happens, please do come to the hospital. Otherwise, you can cure yourself at home. Drink plenty of warm water. Take your paracetamol as and when required if your temperature is going above 100 degrees, or if you have any sore throat, or if you have any body pain, you can take paracetamol at that time. You may find mild shivering feelings, mild feverish feelings. Those are also possible in this Omicron. Please do keep a temperature chart when you are at home. Like how is the temperature charted in the hospital? Sisters keep a chart. Every 6 hours they come and record your temperature and write it down. Similarly, at home also you do that. And you keep an oxygen saturation chart. It is compulsory that you have an oximeter at home, and you take your oxygen saturation and record it, so that we know how your oxygen saturation is fluctuating. Paracetamol would be an SOS thing. So at home you can easily manage the Omicron virus. Most importantly, please get yourself vaccinated. Pregnancy is an immunocompromised state, meaning that in pregnancy your immunity is lower, and you are more vulnerable for infections, any kind of infection. So now in the present scenario, it would be nice if you can take the vaccine. And as you know, world over, people are taking vaccine during pregnancy and lactation. We have been seeing that there are a few people who have something called vaccine hesitancy. It is not just pregnant people. Everybody has a little bit of doubt in their mind whether they should take the vaccine. Even if you take, you are getting infected. But please remember that the level of infection or the severity of infection in people who are vaccinated is much, much lesser than in people who are not vaccinated at all. So vaccine is definitely helpful, especially in pregnancy. We would advise every one of you to get vaccinated. And if you have already been vaccinated and 6 months have gone, please take your precautionary dose as well. So my take-home messages would be: avoid crowds, good hand hygiene, keep your masks on, and please do get vaccinated. Thank you so much.